with yes, yes.
Fantastic. Great.
Okay, great.
Okay, fantastic. So what's the deal with communicating science? Because we have been reviewing in PPCR tons and tons of ways of producing science. But as important as producing science is to be able to communicate and to deliver science into people. And that's always, under my view, a matter of adaptability, a matter of adapting your content to the audience you are directing to. And doing so, most of the times, is done through a particular style that's different depending on what content you're trying to deliver and what audience are you trying to deliver that to. Okay? So we must adapt and we must try to deliver our content the best we can. In this week's case discussion, we are reviewing the situation of one prominent cardiologist who's called Dr. Vengas, and he's working in a very nice hospital in New York City, not very far away from Central Park and from Manhattan, which is the Columbia University Medical Center. And apparently he has been involved in a phase 2 clinical trial that deals with a comparison between a novel drug-eluting stent versus an old one. Okay, so he's undergoing this phase 2 trial. He has already completed all the statistical analysis, and he's trying to redact, to shape his manuscript in order to submit that to a high impact journal and get it published. So he's struggling with some issues, mainly after writing down the method section and the results section. He's struggling with the discussion, which is particularly tricky, as you already know, because you have to confront what you have done in your work with the literature and with the challenging points, acknowledging for your limitations, and also putting in context your conclusions with the state of the art of our knowledge in these days. So in this environment, which is pretty standard, I mean, in this case, we have a cardiological environment, but we could have any, we could be dealing with drugs, we could be dealing with medical devices. In this environment, I have prepared a short quiz for you. It's only 9 questions. It's very, very simple, but it is just for us to have sort of material to work on throughout the lecture. So if that's okay for you, I will be giving around 10 minutes for you to enter this direction. I have pasted it also in the Zoom chat if you wanna just copy and paste. If not, this one you can just directly copy it. It's a short URL, and I will be seeing in real time your answers, completely anonymous. Of course, you can put your name or you can put whatever you want. This is not an exam by any means. It's just a way to have some meat to have our pause on during the lecture, and we will be discussing the questions you answer right afterwards. So I will be counting around 10 minutes. Probably you will be finishing it before. You can tell me if you are all set. It's 1:09 here in Europe. So we will be resuming the lecture around 20 in 10 minutes. Okay. That's great, great, great. Let's give this extra minute for you to finish, and we will start digging into the questions. So, fantastic friends. As you have seen in the quiz, there's a variety of different options we can choose for, also a variety of different topics. And the first topic I was willing to address in this lecture, because it is always conflictive and we can have different opinions, is authorship. Okay, so a majority of the answers have actually selected option 3, which is the main author, of course, is not a thing to discuss about, is Dr. Vengas. And then the statistician, which, as you know, usually goes the second in the publications. And you have chosen the third option, which includes a couple of interventional cardiologists and also a couple of research assistants. So do we have a guide? Do we have an official, advice for knowing who must go in each place for our publications? Well, we actually do. And this is a document that was published some years ago by the International Council of Medical Journal Editors, the ICMJA. And it says that for being considered an author in a manuscript, you should fulfill at least the condition of having participated in the conception of the work, having participated in the full revision of what has been written, and having contributed to the final version of the manuscript. I mean, you don't need to have done the analysis yourself, because that can be addressed to only one of the authors. You don't need to have performed the procedures that are being published in the manuscript, but you need to have been involved in the planification of the manuscript, in reviewing the final draft and making contributions. That are the minimum requisites to be considered an author, okay? And here's a big difference, here's a big separation between what we can consider real world conditions and ideal world conditions. What do I mean? Well, under ideal conditions, in this particular case, only Dr. Vengas, the statistician, and the senior author, which is Dr. Gupta, should qualify for being an author in this manuscript. Why? Because the interventional cardiologists, the research assistants, and the other colleagues in the department probably have performed with their hands the procedures that are going to be published, but this is not only a requisite for being an author. In our careers, we have all faced this situation. As you can see in the bottom part of the screen, I am putting you, the best examples are the ones that you have at home in your own department. This is one of my first publications 10 years ago. I am the first author, as you can see, but there's a lot of people in there after my name that actually not only didn't participate in the manuscript conception, didn't review the final draft, but probably until the manuscript was out, they didn't know that they were going to be put in there to be qualified as an author. Why? Because we all have pressures. We all are told, especially in our early stages of a scientific career, we are all told that you should put some colleagues in your publication because this is a teamwork, and they should be considered in your publication in exchange for you being considered for publication in their papers, in their manuscripts. Is that 100% correct? Well, actually not. Being strict from a journal perspective, only the guys that qualify from these ICMJA requisites should be considered as an author. And in the big name journals, this is revised. When you submit your manuscript, you have to fulfill a questionnaire with the names of each one of the authors you consign. And you have to declare, and you are supposed to be honest, of course, which role has each one fulfilled during the elaboration of the manuscript. So in this particular case, although we can have some discussion, probably the most correct option would be number 1. Okay, just putting in there the guy who actually is responsible for the manuscript as a first author, then the statistician whose work is always recognized by putting them in second place, and finally the senior author, which is Dr. Gupta, who seems not only to have mentored Dr. Vengas during the elaboration of the manuscript, but also, of course, is supposed to have been behind the original idea of the research and reviewing the final draft before submission. All right. What should we do with all those people that have participated not directly in the manuscript, but in the work behind the manuscript? And we are grateful for their work, and we should give them something in exchange for that, from a moral, from a strictly ethical point of view. Well, we can do that by acknowledging them in the manuscript. There's always a section that's called acknowledgements. And under that section, you can put as many names as you want, because that's not acknowledging an authorship. That's just saying thank you to the people you consider. So we have a raised hand in here. And I think it will.
Yeah, Sandra.
Yes, please go ahead, Sandra. It would be a pleasure.
Oh yeah, hi. Hi, Francisco. Hi. I just wondering.
Hi, Sandra.
Yeah, so I didn't choose option 1. I chose option 2. I would like to clarify, like, if the senior doctor is just reviewing the paper, but he didn't design the study, does the reviewer gets to be part of the authorship?
I think you are absolutely correct. Let me explain. You are the utmost. You have chosen the option that is the more strict and more correct. Okay. So if we were very, very, very precise, probably just Dr. Vengas and the statistician will be the guys to be acknowledged as an author. That's correct. What's the issue? It's not very ethical, we could say, to leave the senior author away from the manuscript. It's not very intelligent also if he's your direct boss. And even if he's not fulfilling each one of the 3 legs you should have to qualify as an author, we assume that he was reviewing Dr. Venga's work, and at some point, maybe not directly for this manuscript, he would be mentoring him and encouraging him to do so. So in my personal opinion, and we can discuss about this, of course, it's not an exact science, I would be choosing option number 1, the one with the 3 guys in there, okay?
Okay, thank you.
My pleasure, Sandra. So let's go ahead. What else? Authorship. This is the best way to avoid this kind of issues, especially when you are dealing with studies that involve several centers or several research groups. The best way to avoid this stuff is anticipating. And that's what I currently do. When I have to deal with a registry or with a study that involves 2 or 3 big hospitals, I always have a baseline meeting, which we discuss about what we are going to do, of course. But one of the first things we discuss is who is going in each place. Why? Because this way you not only leave away any potential conflicts, which is very important. You have to be nice to your colleagues if you want them to collaborate in the future, of course. But you also give each of the guys in there a sense of responsibility of their work. If you tell a guy, you're going to be the 3rd author in this manuscript, they feel that they have to do something, of course. So if you agree, if you arrive to an agreement previously to elaboration of the manuscript, that's the best possible way to address these kind of issues. So I always advise to do that before the manuscript work actually starts. For me, the best approach. Okay, guys, let's move on. Questions number 2 and number 3. Well, as you all know, when we elaborate a scientific paper, we can deliver that to our audience in a wide variety of formats. We can do that through a poster presentation. We can do that through a paper published in a peer-reviewed journal. We can do that through an abstract. We can do that through a visual abstract. We can even do that in SoMe, in social media. Actually, it's getting the more and more important to be able to deliver content through the social media. And one of the first stuff we have to face is giving our work a title. Okay, so I gave you these 3 options, very straightforward. As I said before, no one of these answers it's fully correct or fully incorrect. But under my view, I would always favor, the natural grammar. It's very frequent, even in top-notch journals, to find that titles are written with a capital letter at the beginning of each and one of the words. That's particularly disturbing for me. I would always advise guys to use natural language, as you should, okay? So for this answer, and you have majoritarily chosen this option, the first one is the most straightforward one, the one that probably leaves us the naturalist sense of the word. This is not a particularly important issue, but how the information is distributed in a poster is. So here in the bottom of the screen, you can see what would be the structure and the length proportion of a standard paper. We have an introduction that, as you all know, is usually divided into two main paragraphs. Then we have our method section, our results, and our discussion, which can be more or less lengthy depending on the amount of information that's previously existing on the topic or whatever. But this is the usual distribution of the information in a paper that you're going to send for publication in a journal. However, if we move to a poster, there is the distribution is not exactly the same. Why? Because in a poster, we should be favoring, from a visual point of view, the methods and their results section. Actually, in a poster, we don't put any references. If we do so, we can do that in a very small box at the bottom, but usually it's not necessary to put any references. The conclusion should be kept to a minimum, and the introduction too. Probably 1, 2, or 3 sentences would be optimal for an introduction in a poster. So this answers to one of our questions too, in which I was asking you to choose between different formats of a scientific poster. And I kind of fooled you in this sense of the word, because in one of the options I was giving you, I put a small box that says abstract. So here we have had a particularly divided opinions. 40% of you have chosen option 3, a 30% option 1, and a 30% option 2. Under my view, generally you don't need to, I mean, it's not under my view, actually, it's always done this way. You don't have to make an abstract inside a poster, because the poster itself is already an abstract. I mean, the poster is a summing up and a wrapping up of your work delivered in one single big image for people to be able to read it at a single glance and have an idea of what all the work was about. So the poster itself is acting as an abstract. You don't need to incorporate an abstract on your poster, okay? You have to focus mainly on the methods and the results section. That's the meaty part of the work. You should be able to explain how you did your research work. I mean, for the experiment or for the clinical setup to be reproducible, for other people to be able to perform that under the same conditions as you did. And of course, the most important part of posters are images in tables, in graphics. That's the optimal way to deliver the information. So good examples of posters, well, the ones that stand out for the crowd. If you have gone to any big scientific meeting in which everybody is showing their posters, from 5 years or so, some of these posters are being displayed in an electronic way. People can access that through the internet, or even if they are present at the meeting, they can go to big screens that usually the organization puts in there, and they can review the posters digitally. So they can flip and go around from all the posters in 2 or 3 big screens. In any of the formats, you need to be a little bit different. Because when someone is having a short promenade, a short trip in the posters area, he's going to be absolutely lost after 3, 4, or 5 posters. You cannot digest automatically in our brains that amount of information. So my personal advice is to try to stand out from the crowd in the way you determine is the better for you, but you have to find this differential factor. What have I done in the past for this? Well, in the first poster I did when I was a medical student, actually, I put candy on the poster. And you say, well, this is maybe too original. Well, it was a poster about food allergies. So I take benefit of this part of the job, and I put some candies that were allowed for allergic children, who are allergic to milk and to egg proteins. And people were able to take a candy and to taste it and to discuss, oh, this is pretty much the same as other candies or not. So it was a little trick, a little idea that some guys afterwards, speaking with them, said, oh, you're the guys with the candies in the poster. And it was one small tip to stand out from the crowd. In this contest, when I was young, there was also another guy that did t-shirts. And he was wearing the t-shirts around with the logo from his project, and he was attracting attention. So there are lots of different ways. Another thing I did, this was a younger version of myself. This is back in 2014. While I was presenting my poster to the scientific committee, I was holding my laptop and I was playing some videos. I was not allowed to do this digitally at that time. So what I did, I pop out my laptop and I showed some videos. It's also useful to add some support material in this kind of situations. From my point of view, for example, it's also very important to take benefit of the poster layout. I mean, you have the opportunity to deliver all the content of your paper in a single view, in a single slide. And that's very handy, especially if your work has a time linearity. If you have something that follows a timeline, it's very, very nice to put that timeline into a poster. You can also take benefit of that. We will be talking about it later, using some tools that are not PowerPoint, because PowerPoint usually has a limitation of you have to go slide by slide. You can overcome these limitations both in a poster and also using another tools like Prezi I will be covering later. You have to take advantage of the format and which things you can do in a poster that you cannot do in another kind of scientific presentation. It's also important to be organized with the content you are putting into your poster. For that purpose, I usually advise to use boxes and not letting the content float around all these big carpets that finally is a poster. Usually, it is recommended to use clear backgrounds instead of dark backgrounds. Dark backgrounds are usually difficult to print if it's a printed version. And also the contrast of the fonts can be tricky, okay? For the technical part of it, I have done posters both in using Photoshop and using PowerPoint. PowerPoint can be very handy because the final result comes out in a not very big file. If you do that in Photoshop, the issue is that you finally are going to arrive to a very big file size, and moving that around and giving that to the guys that are going to print it can be tricky. So just for your preference, you can do that in the format that is more familiar for you. Probably Photoshop allows you to do kind of more professional results in some sense of the word, but PowerPoint probably 60 to 80% of the time is more than enough for you to elaborate. And remember that the vast majority of the people that are going to look at the poster probably are not going to read the text. They are just going to stop a little bit on your graphics and on the images you are putting in there. So that's the attractive part. That's where you can stand out and you can have an advantage. These were the options that I was giving you in the quiz. So as you can see, first option is very nice. It has a clear background. The content seems to have been organized in boxes. Very nice, but I kind of fooled you a little bit. I'm sorry for that, but it was completely intentional. I put a box with an asterisk in it, and that's not correct, all right? Option number 2, although it may seem nice at first glance, it has a very dark background, and probably it's not advisable. And it also has references, as you can see, and references in this particular case occupy a very big part of the poster, and that also is not considered adequate. Probably option number 3 is the most adequate one to the format. It has a kind of clear background. It's not white, but it's clear. The content has been organized in boxes, and it has been given preference to the results section. So for me, the option number 3 is the clear winner in this way. Okay. Let's move on, guys. These are a couple of examples. This is an example from a basic research project about genes. For me, it's a good example of a scientific poster. Even it has at the bottom some resources, I mean some references and some acknowledgements. This is a big poster, so if you want to put it in a small box at the bottom, it is considered correct. But we could also have removed this part and take benefit of this extra space for an additional image or so. As you can see, the text parts are very reduced. They're only the introduction and some small text at the bottom of the images, what's called the caption for the image. But generally speaking, it's a very clear way of making a poster. Another example, this is one of my personal posters from some years ago. In fact, this is a small part of my PhD project. As you can see, what I did was favoring the images and favoring this big table in the middle, which, by the way, is the one that condenses the meaty part of the study. Even though I didn't use a completely clear background, I took an image of my hospital at the time, and I put that in the background in a faded way. Looking at this from the perspective that the years give, probably a clear background with no images in the bottom would have been better. I think it's fairly okay because I did the boxes with a white background and I played a little bit with the transparency. But anyway, if I had chosen a fully white or clear blue background, probably it would have been better. Anyway, as you can see in the bottom, my study had a timeline on it, and I took benefit of this timeline in the poster format. I couldn't have done this fully exposed in a PowerPoint, but here in the poster, I took benefit of that. And I think it gives a clear idea of what we did. Yeah? We recruited the patients, we performed an image studying, and then we divided them, and we followed them up for a given period of time. That's one of the biggest advantages of a poster presentation. Okay, I hope so far so good. It's not being very boring for you. What else? Well, there's a lot of things we could cover in a small lecture like this one. But as you may know, social media is getting more and more important for scientific work. And social media is rising as a platform for people to share their personal research and for big journals to share big papers that they publish each month. For example, I belong to the editorial committee of the European Journal of Vascular and Endovascular Surgery. And from 3 years now, it's our 4th year, we decided to sort out in the form of a visual abstract the 3 more popular articles of each issue. We release an issue each month. And from all the articles or the papers that are being sorted out each month, we select 3 and we turn that into a visual abstract. It is a very, very handy format that can remember you of a scientific poster, but more condensed. We focus on the results. We just put the title at the top. We have the bibliographic reference at the bottom, according to Vancouver formatting, which I will be reviewing later also. But in the central part of it, we don't use any introduction. We don't do any method section. We focus on the results. It's like in a single image, in a single coup d'oeil, as French people say, we have the main results of these studies. Why you have to consider this? Because some journals ask the authors to provide a visual abstract for their work as they submit, especially if the work is going to get accepted after the first review round. So it's a format I want you to be familiar with, just in case you have to deal with it in the near future. Under my view, it's very handy, and it's a very nice way to share scientific information, also in social media. Let's move on. So, PowerPoint and aesthetics. Why aesthetics are so important? As I told you before, because you have to stand out from the crowd. And do we have any guidance? Well, of course, we have guidance for elaborating a top-notch PowerPoint to deliver our paper to audiences at meetings or even in sessions in our hospital. There are even books to teach you how to achieve the maximum results out of a PowerPoint. But I just want to cover some tips and tricks and some widely accepted advice for you to be top performers. When we started doing presentations, we didn't have PowerPoint, we had slides. And we were elaborating these slides in small photographic paper that we were putting in projectors. And the issue with that is that the contrast was not so good. So a vast majority of these slides were elaborated in a blue background with yellow lettering, which particularly contrasting combination allows the text to be in a format that everybody can read, even in dark rooms. So as an heritage of these times, So you're not very far away in terms of time. A lot of presentations are still being made in this blue background with yellow lettering. I think everybody knows about these examples. I'm not saying this is not advisable, but probably it looks kind of old, and we have a lot of options out there to overcome this format that everybody was using some years ago. As imposters, we prefer to have clear backgrounds. Why? Because sometimes meetings are held in rooms that are not very well lit. Of course, if you're having 200 people in a room and you are projecting your slides in a big screen in the wall, you want to have a decent level of lighting for the screen to highlight, for people in the room to be able to read that. And that implies having a low level of ambient lighting. Okay, so you have to prefer clear backgrounds in order to wake up all the people that probably have started their day very early, and they at some point they can get sleepy. So one way of taking them out of that sleepy trend is to have a clear background in your PowerPoint. At some point, a dark background can be admitted if you have a very large room that's not very well lit, because if not, the screen in a purely white background can be too overlighted. It can be too aggressive. So if you are able to know in anticipation which kind of room you're going to have for your presentation, it's good to adapt your PowerPoint to the ambience in which you're going to present, you're going to deliver. Okay. Usually for PowerPoint, fonts without serif are preferred. What serifs? Serifs are these small tails that some kind of fonts have at the end. Probably the ones that do not have these small tails, like for example, Arial or Calibri, are fonts that are without serif, are easier to read out in a PowerPoint. And usually font sizes below 18 points are not very easy to read, so you should be avoiding that also. What I do for standing out, I mean, we all have this temptation to put things that move and lights and boxes and underlines and highlights in the PowerPoint, but probably just using bold lettering and color changes for highlighting the important parts in the text is more than enough. Okay? It's not too aggressive. It doesn't people get distracted. And the old guys in the room, as I am, probably will remember the first websites that were coming out at the end of the 90s that were full of GIFs and lights and alarms and things that move, and even at some point that sound. Probably that is, as I said before, too aggressive. You have to attract attention, but you don't have to injure attention. You don't need to make people uncomfortable. It's sort of having this compromise between grabbing attention of the audience and being elegant too. And for that purpose, these kind of advices, I think they can be very handy. How do I elaborate my templates for doing a PowerPoint? I have some templates that I have been using for years, and I have passed that by to my residents and to other colleagues, and now they use it in any environment. For example, these are the two institutions I have been working for in the past 10 years. And taking a little bit of the style of each one of these institutions, from the buildings and from the architecture, I just used a couple of pics. And using these pictures, I elaborated a first slide with this image in the background, then a standard slide for putting content in, which takes some elements from the original slide, but favors a clear background. And finally, I always keep a final slide for saying thank you or for saying goodbye. You can do this in a very elegant way, either using images from your hometown or for the town you're living in or your institution is, but you can also put some jokes or put some things that attract attention, and also have people getting out of this boring timeline if your presentation is not very amusing. It's a good opportunity. You have to find your personal recipe for this, but this is the way I have done it, and I think it can be handy for some people. We have been talking about aesthetics, but what about the content? I mean, the content is the most important part, of course. And how can you organize this content for delivering it in a presentation, in a meeting? Well, I always tend to highlight what I call the spine of a scientific work, the spine of a paper. The spine is a vertical line that comes from the beginning of the paper in the introduction and very bottom in the conclusions. And it's a series of questions and answers that should have a direct match. The first point, the first vertebra of this spine is the final sentence of your introduction that, as you all know, it usually reflects your objectives and your design. We review the state of the art of a given topic, and at the end of the introduction, we always say, accordingly, we present the results of a cohort study we performed comparing people with and without this novel drug-eluting stent, for example. Okay? So in that short sentence, we are declaring our objective. We are declaring our study design. And the first stop of this spine is in the materials as method section with the main outcome. The main outcome should be a direct answer to what we declared in this objective sentence. If we declare that with our objective, we want to compare a rate, for example, so our main outcome should be the variable that measures that rate. If you are comparing mortality, our main outcome should be death at each month or at the end of the follow-up. But it should be a direct match. And one good way of being critical with a manuscript is seeing if the main outcome is a direct answer to what the design and objectives are declaring. Okay? So the next vertebra should be found in the results, and we should see how the authors respected their objectives, declared their main outcome, and how they analyzed their main outcome. I mean, the statistical test we choose for comparing the main outcome should also be adequate and should be a good match with our main outcome. And finally, the final step of this spine should be the conclusions. The conclusion should be a direct answer of our design and objectives. If we were declaring that our objective was to compare the rate of mortality at 30 days after performing coronary stenting with these two different stents, drug-eluting stents, so our conclusion should be a direct match. And we should say the death rate at 30 days after operation for these two stents is this percentage, or is comparable or shows no significant differences. All right. So this vertebration of a paper is essential. If you lose this vertebration, you're losing everything. The paper has no support, has no column to be attached to. What I recommend is also between different sections of your presentation to incorporate a content slide or a home slide. It's a slide you used to recall, and that's very useful to keep the audience attached to your PowerPoint. If you're recalling the same slide from time to time, each 4 or 5 slides, if you came back to this slide that can contain the index, for example, of the content you're delivering, or can contain a particular figure or a particular table, if you come back from time to time, it allows people to be attached and to have a sense of unity of the whole work. Okay, that is very important too. And it's also very important to take into account that the content in any scientific paper is Aristotelic. You remember Aristotle. He was a bright philosopher and also a bright scientific for his time. And in some ways, it links with Descartes, like 1,000 years afterwards, because he structured information in a very particular way, first going from the general to the particular, then spending the methods and the results section being particular in our job, in the paper we are writing, and then in the discussion, we broaden up that again. And we start talking from the particularities of our work and putting that in context with what has been happening in the world. So this is the structure. It is also advisable to take into account the number of slides we elaborate. That depends, because sometimes we repeat slides just for a very small change to happen. But if we are being strict, usually the general advice is to elaborate 1 slide per minute of presentation. That's the rhythm that is accepted as good for the audience to be able to follow adequately what you are trying to explain. And what about graphics and photographs and pictures? Well, if you are not having the time to explain that, to stop your presentation for a little while and explain what you are showing, probably it's advisable to remove that. This is my question 4, and I was asking you to choose which one of these slides was, under your view, the most correct one. Actually, a vast majority of you 70% of you have chosen slide number 3. Big kudos there. Congratulations. I fully agree with you. Why? Because in slide number 1, as you can see, the combination of colors is not very well chosen. It has a big picture in there, but says nothing particular about the picture, so that's not very good. In the second slide, we have a nice combination of colors with this white background and this blue heading. But the issue is that the information is put mainly in text, and people is not going to have attention enough to follow what you are trying to say and to read what you are projecting in the wall. So you have to direct the attention of the audience to the points of the slide that you want to highlight. And this is quite well done in the third option, in which with these 2 arrows on the left, the authors are saying definition and how it happens. So you have a direction for the audience to fix their eyes, to stop a little bit and to read what you are intending to say. However, we could even improve this and make this slide in which we say definition, a small phrase, a small sentence. We say how, also a small sentence, and the causes are organized in A, B, and C. For me, this would be the better possible option. So compare the first of these slides, how the text was packed in there with no particular criteria, with no combination of colors, with this one, in which we have presented the exact same amount of information in a different way. This is the point. Being a good presenter is not also a matter of having a good English or having a good style or being good looking. No, it's a matter of directing people to the information they want to read. It's a matter of leading, like a shepherd leads the sheep, people into the portions of information you like the most and you think that are the most important in your work. For me, you were mostly right choosing the third option. What about other options that are not PowerPoint? There's a world out there beyond PowerPoint, although it is 90% the main battle horse for people presenting scientific information. I have been using this spreadsheet for years now, and I strongly recommend that. What is Spreadsheet? It's a website you can register, and some of you will be having access to this tool through your institutions. And it allows to do a giant poster and to be passing and be flying through that poster as if you had a camera or a drone and you were looking at the poster from the top. So you can zoom in, you can zoom out, and you can do lateral and vertical movements. Although if you have an abuse of these movements, it can be a little disturbing. If you make good use of the distribution of your slides, it can help people to follow a timeline or to follow a rationale and a particular argument in a much smoother way that PowerPoint does. Just for you to know, if you have time and you want to explore that for your next presentations, for me, it's a very, very handy tool, and it allows an extra, and it allows standing a little bit out from the crowd. And as I told you before, this is very important. We have lots of people out there. You have to look for a distinguishing factor. What about graphics? They're very important. Probably they are the most important way of delivering scientific information. So we have these tables we want to convert into a graphic, and probably in the early 2000s, we were all also abusing of this 3D kind of graphics for presenting information. As you can see in the top part of the screen, we have this graphic in which you have to make a particular effort to see what is displayed in each column, because they are three-dimensional. You don't know if it's going before or after, has three sides. Well, not very clear under my view. In the bottom part of the screen, however, we have the same graphic, but in a two-dimensional method. In this option, the only issue is that we don't have the data. We should be projecting each bar vertically to be able to read what it says. So we have a third option, which under my view would be considered more editorial oriented, more suitable for publication in a journal, that even it has avoided the use of colors. It's plain black and white, but it gives a lot of information. It is very clear to read. However, it sports at the top of each part the percentage. And as you can see in the y-axis, in the vertical axis, we have the number of patients. This can be tricky, and you have to be very attentive to this kind of graphics to see what exactly the y-axis is telling us. Why? Because I have the same information in this graphic and in this one. The difference is that in the first one, I have percentages on top of each bar, while I keep in my y-axis the number of patients, and in the second one, it's the other way around. So you have to be very careful, because the one that really allows a comparison is this second one that's showing percentages. If we don't have groups that have the exact same size, the number of patients in each bar is not important. The important part of it is the proportion, percentage. So you should be very aware of how this can influence your graphic. As you can see, the first one has nothing to do to the second one. It's very important to be alert on these kind of issues. And when you critically review a paper or a presentation from a colleague, you should be also always paying attention to this kind of stuff. Some tips about showing graphics. Well, you have to correctly identify your axis, of course. It's important also the title of your figures, the title of your tables and graphics. You have to be careful in the use of color, not to be too aggressive, but also to stand out differences between columns. And there's a different type of graphics recommended for each portion of information, of course. Histograms or box plots usually are very good for describing a numeric variable. If you want to see the distribution of an age, of a follow-up time, that's optimal. Bars are usually reserved for categories, and pie graphics, the one that look like a pie actually, they're reserved for when you are showing proportions of a whole. You have a variable with 3 or 4 categories, and you want to show the percentage of each category respecting to the whole of this variable. This is good for a ring or for a pie variable. For example, in the left, you have a histogram, and I usually in my presentations combine histograms with box plots. And I tend to tell people that looking at a box plot is like looking at a histogram and flying over it. Imagine that we have a 3-dimensional histogram and we are flying with a plane over it as we fly over a mountain. If we look from the top of the histogram down to the floor, what we're gonna see is something very similar to this box plot. It's a good way to relate in both in your head, in your imagination. And it allows you to know what the median was, what the 25 and 75 percentiles were, and where the whiskers are. So it's a good technique for people to have an idea on the distribution of data. And as you can see on the right, you can reach a high level of complexity when you are doing pie charts or ring charts, which, by the way, are actually the same. So we have 2 different moments, one in the center ring and one in the outside ring, and we are comparing percentages. So it's very useful. You can develop these kind of skills for your personal presentations. So going to the particular way of doing that in Excel you have a lot of different customization options. You can use, as I said before, black and white patterns for filling your bars instead of colors. And it can be a good trick depending on the journal you're submitting. Some of them will be preferring a more refreshing look, and some of them will be asking for a more traditional look. If it's a second option, going for this black and white can be a good choice. And if you are sending images, you should be aware, and probably some of you have already sent some papers out in the wild, and you have seen that the online platform you upload your information for the paper to be reviewed, at the end of your submission, gives you an information on the art quality. And if you are submitting pictures of patients, of CT scans or whatever, sometimes the resolution is not going to pass the quality criteria of the journal. But you have tools like this one, for example, which is the one I use. It's a software called PhotoZoom Pro. There are even some online tools you can use. You can Google them and they will be handy, that allow you from a very small resolution image, like the one on the left bottom, to enhance the resolution and to allow a minimum quality loss for you to submit. This can be handy for this kind of submission. So if it's a good tip for you, just take note of it and take the maximum benefit. What else? Tables, for example, are also a thing that can be messed up. You have to be very clear in the way you display your information. In this case, As you can see, there are no vertical bars. If there are not a lot of vertical or lot of columns, this can be a good option, as it allows you to display all the information in a single row without any interruptions visually from left to right. And the captions or the footnotes you put in each table are also a very good option to clarify what you are telling in each one of the cells. For example, if you want to elucidate an acronym that you are using on one of your cells, you can put an asterisk and elucidate the meaning of that acronym in the bottom. So it's good to play with this. It's very handy, and try to keep the look of your tables as neat as possible. This is an example. You can do it however you want, but keeping in mind that sometimes the simplest, the better for this kind of stuff. Okay, guys, so we are moving on. Hope it's not being too boring for this time of the day. Questions 7 and 8. In question 7 and 8, I was asking you to rearrange ideas for a paper in the statistics sections. And this is one of the parts that's good to start. If you are starting to redact, to write down a manuscript, one of the best places to start is this statistical section. Why? Because it's pretty standard. You can even copy that and adapt that to your manuscript from other papers you have read and you have liked how they were telling this. It's always done in pretty much the same order. You start from the descriptive statistics, then the inferential, the tests you used. If you have a multivariate analysis, you can put it afterwards, then survival, then the level of significance you choose, and finally the software you use. And remember that the software we use for doing the statistics in our paper are commercial products. And from a journal perspective, commercial products should always be referenced by the company name, then the city, and then the country, okay? If we are not seeing that after a product, we will be asking for that in the reviews. And so the less things you make a reviewer stand out of your paper, the better. So statistics is a very good starting point. If you have doubts on where to start, this is a very good point for you to start and to accelerate the process. And another very important thing that was referenced in question number 8, the Vancouver format. It's the standard for biomedical journals, not for other kind of journals and not for books, but yes, for the vast majority of biomedical journals. And remember that the Vancouver formatting rules were reviewed back in 2018. It's going to be 4 years from now. So the first we have to consign is the authors. The first name is always abbreviated, of course. Then the title. And well, concerning the authors, remember that the correct way of doing that is you can consign up to 6 authors. If there are more than 6, you can go for et al. Okay. Then the title, then the journal name without a dot at the end of it, then the year, and then the volume and the issue is removed. And this is important because in the previous versions of the Vancouver rules, the issue was consigned, not in the new rules we have from 2018, just for you to keep it in mind. And finally, the pages. And the pages, the only thing you have to know is that the numbers that are repeating, you shouldn't be putting them. I mean, for example, if the paper is going from page 25 to page 29, we only have to put 25 and then 9. You don't have to repeat the 2. Okay, so this could be an example. Let's see. Now, I think I don't have an example here, but well, it's pretty straightforward, just for you to know that there's a new version of these rules in 2019, and this is the correct one. Okay. And now I would like to give you my personal 2 cents on the publication process. I have been working for editorial committees of journals for some years now. And just a month ago, I was promoted to be the associate editor of our European journal. So I am getting more and more involved. And the more and more involvement I have, the more I learn. And the more things I see that I could be improved, actually. It's a personal journey, of course. It's a thing that only you can discover. But for example, my 10 tips and tricks on this. The first one is having a well-directed research. The most important factor for being successful in publication is being able to offer something new, something that has not been addressed before. And for selecting a good investigational gap, you have to have your mind clear. You have to be a good knower of what has been done and published before. You have to be challenged by yourself and also by your colleagues, because nothing more than contradiction and controversy and discussion stimulates new research and new ideas. Okay, you have to be quite curious. You have to be hungry for new information, be hungry for new ideas. And usually, if you combine a clinical and a research career, this can be tricky. And it's always hygienic, and it's good for you to keep always a time for yourself for performing different activities away from your main clinical dedication, because this is going to refresh your mind and keep you keen, keep you with your knife sharpened in terms of being able to select good research questions and good research projects. Okay. Then we go back to the spine. Whatever is your research topic, no matter what you have selected, you have to be very strict with this way of describing things. Your objectives should have a direct match with your main outcome, with your statistical test, and with your conclusions. Keep in mind what Aristotle used to say. Keep in mind this structure for any presentation, no matter if it is a poster, if it is a conference, if it is a paper. This spine should be always respected. It is one of the things that reviewers are looking closely in any paper, if there's a good structure. Then other things can be improvable or not. You can have a very good discussion, you can have a very short discussion, but if the spine is well respected, you have good chances of getting published. For non-English speakers, it's always good, if you are not feeling very comfortable with the way you write or with the final result of your manuscript, to look for a professional aid in this. There are services out there, both online and in institutions, that can review your English from a scientific point of view and adapt that English to the journal you're submitting. This is probably the best spent money in any project. If you are having issues with the language, spending a little amount of money on a professional service for this is always a good investment. For example, here in the European Journal of Vascular Surgery, the biggest series we receive for publication come from China, probably. China has a huge database, and they perform an enormous amount of procedures yearly. And they come out with very nice papers that are very useful for evidence, because they have a very big sample size. Sometimes the issue with this is that the first impression is not that good because of the language. So it's very good to recruit a professional translator, or to have the help of a colleague that is very keen and very handy with the use of scientific English, in order for the first impression to make in a journal to be very good. And if you have any kind of doubts with this, it's good to invest. It can be expensive or not, but the amount of money you put into this is always well spent, much more than in other parts of the paper. Next, how the particular process of writing is done. Well, of course, you can do that in a plain Word document or in a Pages document if you are Macintosh users. But there are some apps out there, some pieces of software that are going to be specifically formulated for scientific writing. This is one example. It's an app called Manuscripts that keeps, an outline of your paper on the left and allows you to jump very quickly from section to section. This is very important when you are incorporating the information from the papers you have reviewed. I personally have different applications, different softwares for keeping my collections of bibliography. The one that I use the most it's called Papers for Mac. And I have all my collections organized by topics. When I am writing or reviewing a particular topic, I read in Papers, and then I move to this Scrivener application, and I consign each portion of information that I find valuable and I want to discuss about. Maybe I can do that in the introduction and the discussion in 2 clicks. If I have to do that in a Word document, I have to scroll the document up and down. And that is a loss of time and can be confusing, and finally gets you tired. So consider using these kind of softwares that are specifically designed for scientific writing. They can save a lot of time, and they can also help you with managing bibliography, with managing literature, and you're keeping your ideas in a good order, which finally can be messy. Imagine writing a PhD project, which can have a lot of pages on it, hundreds of pages. Imagine trying to scroll 100 pages document to find a particular paragraph in which you want to mention a reference or to cite a reference. So for these particular cases, it's very, very handy to count on these new softwares that are available. Next, review your ideas. It's always refreshing when you have finished writing your paper. It's always good to take a 1 or 2 day break, leaving it completely away, then coming back with a refreshed mind. Always having a little time for resting and for keeping your mind away from the same work. It's always good and it's refreshing for your ideas. For example, as you can see, this first paragraph we have here says the potentially superior anti-plaque and better surface active properties of amine fluoride and stannous fluoride contained in mouth rinses were carefully investigated in a well-designed double-blind crossover study in 10 healthy volunteers. Okay, this is a very, very long sentence. How could we do this and could say the same information in a different way that is more nice to read, that is nicer, that is brighter to read? We investigated the anti-plaque and surface active properties of mouth rinses containing amine fluoride and stannous fluoride in a double-blind crossover study in 10 healthy volunteers. Exactly the same stuff in 2 different ways. The one probably that's more light to read is the one at the bottom. More tips. As I said before, if you don't know where to start from, the method section is the one that's easiest to redact. And it also encourages you, as soon as you have your methods section already written, you have this sense of having completed at least 1/4 of the paper, and it's going to be a good stimulus for continuing with the rest of it. In particular, in the method section, the part that's pretty much standard, and I advise you to start from, is the statistic parts. So it's very, very nice to start from this section and to have this sense of completion of a particular part of the study, and then it encourages you to go for the other ones. Good examples. This is my particular good example. First, it addresses the descriptive statistics, then the test you use for inferential statistics, then if you used a multivariate approach, it describes it, and finally, what p-value was selected, that it's pretty much standard with 0.05, and what software did you use for your calculations. This is an example. Don't be mad at it. Don't be afraid of it. It's the easiest part of the manuscript, and it's a good start point. What else? Well, as I told you before with the spine example, try to follow the same order for communicating the results as you followed in the methods section. In fact, the results section should mirror the structure of the method section. And it's always good to inspire from good papers you have read during the review process of your new manuscript. If you particularly like how an author has organized his paper, don't be afraid to imitate what he has done. It's not a matter of plagiarism, of course. It has nothing to do with plagiarism. It's a matter of inspiration. If you had good examples, in my personal library of papers, I keep a section that I call favorites. In that favorites, I keep papers, no matter the topic, that I like from a structural point of view, from a communicative point of view. It's good to imitate the successes of other people, and other people have worked the same way as you before. It's good to take benefit of that and to avoid committing the same errors as they did. For the references, this is example I was looking for before regarding the Vancouver formatting. So the authors, then the title, then the reference, and don't repeat the pages. It can look very simple, but it's very difficult for me. Currently I review around 10 to 15 papers per month. And it's difficult for me to find a month in which a single paper was perfect from the point of view of references. And they are very good papers. It's the top-notch journal in our field of knowledge. But they're very good papers that sometimes don't pay attention to these small details. And every small drop counts, especially it's very easy to address like this one. You just have to have a minimum amount of attention for you to put it correctly. And finally, what happens after you send the manuscript? This is probably the most frightening part. You send the manuscript, you have silence in your mailbox for a month or 2 or 3, depends on the journal. And then you're receiving a letter, in the best of cases. If you are not getting a top desk rejection, you are getting a letter. And probably that letter at some points can be disappointing because you were expecting your work to be appreciated by the reviewers, but at some points it's going to be subjected to a nice level of criticism. You don't have to be discouraged. What is my advice for answering this first row of review, which is very important? Well, accept all minor revisions, even if you don't agree. I mean, if it's a matter of language issues or reviewing your references or having a minor change in a graphic, it costs nothing to you. And if a reviewer is asking for that, usually it is considered well-mannered to accept all minor revisions. Regarding the big changes, you are not obliged, you don't have to compulsorily make any change you are asked for, not at all. Usually 50% of the suggestion they are making you, of the major suggestions, is considered a good proportion of acceptation. However, if you are not accepting some of them, which I advise, you have to argument why not. And sometimes you just have to put, I respectfully disagree with the reviewer's opinion regarding this issue, but we consider it is better the way we enunciated it in our first version of the manuscript or whatever. If you are respectful and you acknowledge the work of the reviewer, nobody is going to feel hurt. Nobody is going to feel disappointed. Not the reviewer, not you. But remember that it can be, it should be a balance between the ones you accept and the ones you reject as a change request. You also have to be very careful with the cover letter. A vast majority of the journals ask for you to write a cover letter for the paper. It's just a small paragraph in which you say, dear editor, we are sending this manuscript we made for your consideration to publication in your journal. And we feel it is important because it adds this and this and that. So it's sort of a wrap up of your work that it's a good starting point because it's the first document that the editor is going to see when he's asked to review your paper. So if you redact that in a nice, clean way in which you sum up why you feel your paper is important in a global context, you have extra points. You have a good attitude of the editor towards your paper. So it's good to be especially attentive when redacting this cover letter for the editor. And very important, never be discouraged by a rejection, never. There are histories out there of people submitting 1, 2, 3, 4, 5 journals and finally get accepted in another journal. It's non-scientific, but for example, J.K. Rowling, the author of Harry Potter, was rejected, I think it was in 7 or 8 different editorials before getting finally published. And look now the huge amount of success she has had. Never be discouraged by a negative review. And the useful part of it is that no matter if the reviews are being more or less nice, they are giving you advices. And that advice is very handy for your next submission. If you are rejected from a journal, always incorporate the comments you received from the previous journal in which you get the rejection for the next submission. That's very important. In fact, I recommend my reviewers to offer advice, not to offer criticism. Even if you are rejecting, you have to give advice for the authors to improve their manuscript. It's not a matter of saying no, no, no. It's a matter of saying no because this is the reasons why we are rejecting. And the best way of learning and improving how you write is actually getting reviews from people that are solvent in their field of knowledge, that have a solid position. They are reviewing for good journals. And this is very useful for you to learn and to have a feedback, not only from colleagues, not only from courses and books, also from real world. So if you are in doubt between submitting or not, it's always good to submit, to receive this feedback and to learn from what they are saying to you, to resubmit to the same journal or to another different journal. So guys, I think we are coming to an end. I hope to have been not very boring. I hope you have been able to take at least 3 or 4 tips for your personal scientific development. As I said before, this probably is not an optional lecture that's being covered in any kind of exam, but the most important exam is not the one you're getting in PCR or in your academic life. The most important exams is the one that you are gonna have in your daily life, in your daily career as a scientist, as a paper maker, or as a PowerPoint maker. Remember that I are at your full disposition for anything you may need. At this email, you can reach me whenever you want. We can discuss and I can give advice. The knowledge that I have is always at your disposition. And thank you all for coming. It has been a huge pleasure.
Thank you, Francisco. Thank you for the great lecture. Actually, I learned a lot. We have one question from Richard. Can you do you have any chance to?
Oh, Richard. Oh, nice, nice. Hi, Richard. So Richard says, if we are ever rejected with some advices on how to improve, should we try to resubmit our work to the same journal? Well, that's a good question. It depends. Usually, when you have a paper that is rejected for a particular reason, that reason is a very weighty reason. I mean, if a journal says no for a matter of design or for a matter of the population you have recruited or whatever, probably it's not a thing you can solve in order to make a new submission for the same journal. But sometimes the own editor or the own reviewers suggest you to reformulate your manuscript or to make some sort of changes. And instead of submitting a reviewed version of your manuscript, they encourage you to make what they call a de novo submission, which is the same paper with the correction they suggested for a different kind of study. For example, if you have performed a cohort study and your main outcome was an image, for example, evaluating the size of a tumor, maybe they suggest you to review again your images and to add another marker or to add another outcome. In this particular case, what they are asking you to do to your manuscript is so big that probably it's not the same study. In those cases, you can resubmit to the same journal, because what the reviewers have been asking for is to change your study, not to reformulate or to answer to some requests. What they are asking you to do is to do a different study with the basis of the same one you presented. Only in that cases, you should be submitting to the same journal. If it's just a matter of the reviewers disliking your work, probably submitting to the same journal, no matter if you accept their correction, is not going to be very intelligent or very successful.
Okay, thank you so much, Francisco. Thank you for the lecture.
You're welcome, Richard. Thank you very much.
So
guys, any other topics, Keiko?
I cannot find any other question, but I personally very interesting because next week I will give some lecture. So I learned a little bit about the presentation about your lectures.
Oh, you're very kind.
Very good for me.
You're very kind, Keiko. Tell me.
No, just I am thinking any other people have a question or not. If not, maybe they are all clear, I think. And then
that's great.
Okay, one more from Ricardo. Ricardo, if you like, you can open your mic.
Yes, I'm sorry. It's just that I was waiting for anyone to ask. I have this specific doubt. I have listened that sometimes we gotta use like active voice in some part of the manuscript, and in some parts use the passive voice, especially in the methods, I believe. So what's your opinion on that?
Well, it's a very good question, Richard, actually, because we all know good examples of use of one or the other. My personal 2 cents on this probably would be to attach to the third person, I mean to the passive voice, as much as you can. Why? Because using the first person can give a tricky sense of familiarity that probably is not very scientific. However, there are particular environments in which this can be very handy. For example, I would not advise a first-person redaction for any paper, but I will do for a PowerPoint communication or for a direct communication in a poster. It keeps the reader or the audience close to your work. For submitting a paper, probably it's advisable to keep the use of the first person to a minimum. It's not considered incorrect directly, but probably it gives a more professional sense of it if you use the third person, the passive voice. So it depends. I mean, each journal you submit has a small PDF that's called recommendations for authors or guides for authors. Before submitting, it's always good to download it and read it, because some journals are very clear with that and they ask you to use the first or the third person. Generally speaking, I would always go for a passive voice, except for some very particular environments, as I told you.
Okay, perfect. Thank you so much again. Thank you, Francisco.
You're welcome, Richard. Well, guys, thank you for coming. It has been a pleasure to be with you. For me, it's like the 10th year or 11th year in a row. I can't believe it. these guys are counting on me year after year. They don't know what they are doing. But for me, it's a great experience. It has been very, very nice to share this time with you. And remember that I'm easy to reach from email if you have any needs on this. I can hear you, Keiko. I think you're muted. But I think you're saying goodbye. So that's great. Take care, guys, and best of luck.
Thanks so much.
Best of luck and best of energy with your project, guys. Keep the high spirit working. And I am sure from this PPCR 2022, we will have great examples of papers and great examples of success in the near future. Take care, guys. See you around.
Thank you. Beautiful lectures.
Bye-bye.
Bye-bye.